Hi, I'm Karen Schultz. I'm from Queens Medical Center in Honolulu, Hawaii. And I came here to the conference to learn more about starting a transplant center. We may become one in Hawaii. And this has been extremely helpful in answering a lot of my questions that I had. And also the contacts and learning a lot about the tools and the information that we have that is out there.
Great, thank you. Yep, no, you're good.
Okay. Hi, I'm Rebecca Anderson. I'm with Memorial Medical Center in Springfield, Illinois. I'm a transplant administrator there. I've been in my role for 2.5 years. So this is a very valuable and timely event for me to get this kind of overview and actually meeting face-to-face some of the people that I come in contact with throughout the year.
Great, thank you.
Okay. Hi, my name is Genevieve. I'm lung transplant coordinator from Columbia Presbyterian in New York City, and I've gotten a wealth of information from this primer, and I think and I hope that UNOS will do this more and give everyone an opportunity to attend.
Great, thank you.
Thank you.
Okay.
My name is Mario Paquette. I'm the data coordinator for the Transplant Center in Las Vegas, Nevada. I have found this session super excellent. When I started as the data coordinator in my program, I was the very first one, and there wasn't not much education available with tie-dye and listing patients, and I have found this great. They've gone through all the steps on how to problem solve, how to list patients, gone over policy, and it's very recommended for everybody in transplant to attend one of these training sessions. Thank you.
All right, thank you. All right. You're good.
I'm Ann Krieger with the Wisconsin Donor Network, and I thought the UNOS primer was excellent. I found the policy development piece and organ allocation talks probably most beneficial. I've gained a greater appreciation for the process in policy development, and also feel I have a greater appreciation as for UNOS and the OPTN as a valuable resource to all of us in the organ donation and transplant community.
Thank you.
Wow, what a day, huh? I think we need to give a big round of applause to our speakers and the conference organizers. I think one question I'd like for the OPO community that's here to comment on is, would this be helpful for us to do combined programs, or would you like to think about some combined and some sort of splitting off or whatever? And give us some feedback, because honestly, this was planned sort of thinking that it would be a transplant community, and I'm thrilled our OPO partner showed. So help us know how to help you. If you have any other questions that just, pop up as you're going out, or you're thinking about, all your speakers have their email addresses in your packet on your flash drive. So, and I'm sure they'd be delighted to get a lot of emails coming in. They're looking at me. I think the stop sign went back up. All of us that work in hospitals right now, I don't know about the OPO community, but as healthcare reform comes in and, so on and so forth, we're all challenged to try to keep high quality programs, keep the staffing we need, to keep people well educated, to prevent turnover. Can you imagine how long it takes us to get everybody trained up to the level they need to know? I, as someone who's been a transplant administrator a long time, put a lot of ahas together this last day and a half, and just the connections. And I know one message I'm taking back to my hospital administration is that in order to have a transplant program, you got to have what you need to get it done. It's our job to articulate what's needed. Because guys, at the end of the day, this is rocket science. When you look at what it takes from the OPO side, pass that through, get that organ where it belongs, so we don't have any transportation issues, as we call them, land it safely, get it transplanted with no disease transmission, so on and so forth. It is a miracle. And then look at our outcomes. I mean, we've come a long, long way, and I think it's remarkable really what's been accomplished in this country. And I think we owe a tremendous debt of gratitude to the OPTN to help pull this together and create this just amazing opportunity. I know I work with other specialists, and sometimes when they come to our outcomes meetings and we're able to produce the SRTR reports, et cetera, they're blown away by the amount of statistical information we do have at our fingertips. And I think Jenny did a great job of showing us how to take that data and use it. And I think there's plenty of training opportunities. And UNOS is us. And I hope if you don't get anything else out of this program the last day and a half, is you understand you've got so much resource available to you here. And they really are here to help. They're here to serve. And there have to be rules of engagement. And I thank you for this last part of the presentation, because you help us understand why. And we all want it safe, and we all want it fair, and we all want it effective, and we all want to be able to turn around and say to our patients and our constituents, here's why we did what we did. There aren't enough organs to go around, so chip some more in so there can be some more. So all I can say is go out in the world and do good, and thank you all so much for coming. Take care.